Hello, everybody. I'm Andrew Salciunas, 97.5 The Fanatic. And today I'm joined by Dr. Agunbiade. And I'm so excited for this because I know this is something that everybody needs to know, because I feel like everybody has dealt with heart failure at some point. Maybe not you personally, but somebody in your family, whether it's a parent, a grandparent, a sibling, somebody younger than you, who knows? We all know somebody that has dealt with this. So I'm glad that we're going to be getting this chance to speak to Dr. Agunbiade. And you know what? If you want to talk about resumes, she's got it. All right. Cardiologist, director of the Advanced Heart Failure Program at Virtua Health. She studied at Harvard Medical School, completed her residency and fellowship at Johns Hopkins University. Doc, you've done it all. So thank you so much for gracing me with your presence. And you're going to be teaching us a lot today about heart failure. How are you today?
I'm doing well, thank you. And thank you for the time and the opportunity to be here today.
Oh, no, the opportunity is for me, because again, I get to learn about all the great topics that we talk about. So let's start off a pretty easy question, or maybe it might not be an easy question in terms of the answer, but what is heart failure exactly?
So that's a good question. So heart failure, it's basically a condition where the heart is not able to do its job or pump as well as it should. There are two types typically. A lot of people have the type where the heart muscle is weak and it's unable to pump blood to the rest of the body as well as it should. And then some people have the type of heart failure where the heart muscle is stiff and it's not relaxing as well as it should. But both of them can lead to similar symptoms of heart failure.
And what are those symptoms, right? It's not just I walked up the steps and my heart was pounding, because I should probably do that more often. But what are some of the symptoms of heart failure?
So some of the common symptoms that we see patients coming in with is shortness of breath. And so a lot of people will say that, I was walking a block or walking at the mall and I noticed I was more short of breath than usual and I had to stop and rest. If you have stairs at home, you're climbing the stairs and you're feeling short of breath just before you even get to the top. And some people have to pause even. Another common one is swelling. So patients that develop new swelling in their legs and in their feet. And then additional symptoms would be if you're trying to sleep at night and you have some of those other symptoms, the shortness of breath or the swelling, and you find that it's hard to lay back comfortably, or you feel like you're drowning when you lay back to sleep and you have to kind of prop yourself up to sleep. So those are some of the common symptoms that we see with regards to patients coming in with new diagnoses of heart failure.
Now, when should we start being concerned, right? We all do it, right? We try to figure out, all right, what's wrong with me, right? I sneezed. Do I have COVID, right? Or is it just a common cold? But sometimes, I could just be short of breath because I haven't exercised enough recently. So when should I really start being concerned when some of these symptoms are showing?
So I think that's a great question. And you, just as you said, a lot of us can explain away our symptoms because we think it's something else. I would say that if you're noticing a big change from your typical baseline, so if you're someone that's never really had swelling in their legs, and then suddenly you see your legs are really swollen, you're not able to wear your shoes, for example, and you're short of breath, and that's a big difference from your baseline. I think that's worth getting checked out. If you're someone that was walking 3 miles a day, and then suddenly after a mile, or you're like, I'm done, I'm too tired, or I'm too short of breath, that's another big change. So if you notice a big change from your typical baseline, or you're at all concerned that, something is just not feeling right, I always think it's worth getting yourself checked out just to be on the safe side.
So now we know when I do come in, we get checked out, it is true I have heart failure. So what is the treatment? What do you and the team at Virtua Health do to treat somebody who has heart failure?
So I think that's, it depends on the cause of the heart failure and what type of heart failure someone has. So if someone is diagnosed with heart failure, the first step is always to say what's causing it. And so depending on the cause, sometimes it's because someone has coronary disease, they have blockages in the blood vessels. If that's the case, then we would say, okay, what options do we have to open up those blockages, whether it be with stents or with bypass surgery in some cases. If someone has valve disease that's causing the problem, then we'd say, okay, let's see if we can fix the valve disease, and that will help the heart muscle to get stronger and help the symptoms to improve. In other cases, there could be a problem in the heart muscle itself, and depending on what the cause is, once we've completed the workup, then we treat it accordingly. But the mainstay for the most part, once you address things like a plumbing issue with needing to open up blood vessels, or a valve issue with a procedure or a device, then it's medications. So there are a lot of good medications that are available now to treat people with heart failure that have been proven to help people live longer and also to help the symptoms get better.
Now, speaking of medications and anything else, so, when the doctor tells you, hey, you suffer from heart failure, obviously there's probably a shock that goes through the patient, and you're just sitting there and you're trying to circulate everything that's going on, what you're thinking about. So obviously questions might be hard to think of in that moment, but if you could take a couple of minutes, what kind of questions would it be easier for us to ask so that you could give us all the answers that we need, medications being one of them? What kind of medications would I be on? And what else can I do to make myself better for the long run?
I think that's a really important question. And so some of the questions to ask is, first one I would say is, what's causing my heart failure? Why are you saying I have heart failure? Why is my heart suddenly weak? The other question would be, okay, so I have heart failure, and it's either it's newly diagnosed, so you've had it for some time. Another question is, are there any new medications or new therapies that I should be on to treat the condition that I have? So I think some of those are some of the big questions. And what changes do I need to make that can help me to either feel better or to live longer?
Now, that's a big one that I want to ask about, living longer. You mentioned it now earlier. You said there are medications that help you live longer, the treatments that can help you live longer. So let me ask you, and I'm sure this is something that's on everybody's mind when they find out that they have suffered from heart failure. What is the kind of life experience moving forward after you get heart failure? And let's hope that everything goes well, right? You get treated well, you get the medication, what's kind of like that quality of life that we can expect moving forward?
So that's a really important question. So for most people, after that initial episode or the acute insult that they have, we're able to stabilize them, treat them, get them on good medications. And for most people, we can get them back to having a good quality of life. And then they can stay like that for years and years and years until or unless something starts to then change and progress down the road. So with our medications, we have good medications that can help improve the symptoms of shortness of breath, for example, the swelling, and then with improving those, you can improve your exercise tolerance. So I would say that for the most part, we are able to get most people to the point where they have a pretty good quality of life. And then it's when they're starting to really progress or get much sicker that may not be as easily achieved.
Okay, well, it's good to know that there is a chance that you can have the good quality of life, and hopefully everybody who is watching this that may have suffered, knows somebody that may have suffered, that is a possibility. Now, speaking of people watching this, and look, selfishly, me, myself, and I want to know this: can heart failure be passed down? Is it hereditary? Could it run in the family? I mean, I honestly don't know, and I would like to know.
Yeah, so I think that's a great question. And yes, certain types of heart failure can be passed down from one family member to the other. And so that's part of the first thing I said when someone has heart failure is the question of why they have heart failure. Why is my heart weak, or why is it not? Why is it stiffer than it should be? And so doing that thorough evaluation, because sometimes we find that there are causes that are hereditary. Certain conditions are passed on. And so in that case, we'll talk to patients about family screening. But yes, it depends on the type, but some of them can be passed on.
So if I know somebody that has had it in my family, and it could get passed down to me, or even if somebody doesn't have somebody, a parent or a grandparent that has had it, what kind of lifestyle changes could somebody make, or that you would recommend to make, just to prevent that risk of heart failure?
So when you're thinking of preventing the risk of developing heart failure, I think of the risk factors for heart failure. So among those would be poorly controlled hypertension. So that's one of the things, if your blood pressures have not been well controlled for years and years, that can increase your risk of developing heart failure. And so along those lines, I would say if you're someone that's been diagnosed with hypertension or high blood pressure, you should really make sure you're seeing your doctor regularly and ensuring that your blood pressures are at goal and well controlled. Other risk factors would be things like coronary disease is a big one. So people who have heart attacks, that's a high risk of developing heart failure. And so things that would increase your risk of that would be poorly controlled diabetes. So if you have diabetes, make sure you're also following with your primary care doctor, making sure your blood sugars are well controlled. Tobacco is a big one. So if you're smoking, we know that that's been associated with increased risk of developing coronary disease. So I would encourage anyone who's smoking to start the plan towards quitting smoking now. And then, of course, having a heart healthy diet and not being overweight and exercising to minimize your risk of obesity, which has its own associated risk factors. So I think those are the big things I would say to focus on.
Doc, you were fantastic. I appreciate it. I mean it from the bottom of my heart. Every time I do these with a different member of the Virtua Health team, I learn so much. And I just hope everybody that watches learn as much. A buddy of mine actually texted me after our last one and said, man, thank you for doing this. Like, I actually learned a lot, and he had family history of what we discussed. So thank
Oh,
you so
wow.
much for doing this today. I learned a lot. I hope everybody learned a lot. But if there's more information that you need or you missed something, make sure you check out the Virtua website, go.virtua.org/heart consult. Again, that's go.virtua.org/heart consult. And you'll get more information that way. I promise, Virtua is an incredible team where you're going to get all the information that you need. So, Doctor, thank you so much. I really appreciate it.
No, thank you again for the opportunity. This was a lot of fun.